Can I set you up? This is really so easy. In fact, as of August 1, folks, Catholic priests in this country who run Catholic hospitals in this country, according to the HHS mandate, have to subsidize products, pay for, provide, that go against their very religious faith. There are lawsuits aplenty. 59. There is a Catholic manufacturer out in Colorado who owns a small business who said, that goes against my religious freedom to have to subsidize these products for my 125 employees. So it will fairly quickly go into our legal system. But this is a profound issue that impacts all of us. And because we're so focused when it comes to Obamacare on what it's going to do to the economy, on what it's going to do to small businesses, on what it's going to do to our debt, on the taxes that are just littered in this piece of legislation, and I would argue on what it's going to do to the quality of our health care, we often overlook what, and maybe Barbara agrees with me, is probably the most important aspect of this, the absolute trampling on of religious freedom.
I said it's just the tip of the iceberg, and it's not just a Catholic issue. You know, many people have principles as to how they want their tax money spent. And you know, I shouldn't get into the issue of abortion, but since it is not specifically prohibited, I mean, I'm an attorney also, so since when things are specifically written as prohibited in this record, and abortion is not written as prohibited, the lower courts will read it to include it as services that can be included, because it's not prohibited. And as I said, it's just the tip of the iceberg. When you can trample or disintegrate or affect our religious liberty, there's no limit. That's it. This country will go off a cliff on November 6th if we do not turn things around. You won't recognize it.
What is the status of the 15-member committee, the IPAB? What all will they be responsible for? And are there any integrated medicine doctors or natural care providers on this panel?
No, we know it's composed of 15, well, I guess I'm off here. But anyway, it's comprised of the 15-member independent Payment Advisory Board, IPAB. Exactly. Yeah, so we both know. We all know. So what is the effect? I mean, they're going to decide what will be covered and not covered, and what cuts will be made, and you tell us more details.
Yeah, so the IPAB, and I believe there's been several bills, and I know we've been heavily pushing for the repeal of the IPAB, so this as have many groups, because it essentially takes the accountability away from our elected officials who typically make the decisions right now with respect to particularly Medicare payments and Medicaid and how that system works, and what they're designed to do and set up to do is sort of look at how everything's working or not working, and start to make cuts or reductions in order to keep this afloat is essentially how it's going to amount. So it is. Physicians are facing a 31% reduction in the Medicare. Medicare physicians are facing that reduction, I believe, 2013. That is to say that they could face more reductions. So you cut payments. What the Affordable Care Act is also trying to do is totally redesign the system in terms of how you pay for services. If you've heard of these accountable care organizations, kind of this pie in the sky type of vision of hospital systems merging with clinics, standalone clinics to create these mega giants, and it's all under the Medicare program, and incentives and sort of global payments. So you hand a chunk of funding to this system and you say, you need to make it work, and you need to take all the risk. This is what you have to work with. You have $500 million to work with, all the patients you're seeing under Medicare. You have to make sure that their outcomes meet it. And if you spend more than the $500, you have to absorb that. That's the direction this is all moving in. And you can have an opinion about that one way or the other, but it is creating sort of a monolith sort of system where your doctor's office in the rural areas are kind of being absorbed by these mega healthcare systems. And it's kind of going a little bit afield of the question, but that is to say how the system is being redesigned. It's a complete change, and something that is going to, we're talking about decades of this occurring, and it's all supposed to happen around a rapid timeline. So this Independent Payment Advisory Board is really kind of watching all of this happen and unelected, unaccountable to the taxpayers and the voters, and deciding how they start to carve it up if it's not working, which I pretend it's not.
15 unelected bureaucrats. 15 unelected bureaucrats, unless this thing is repealed, will make every Medicare decision in the future. This is how President Obama intends to control Medicare costs, is to ration. There's no other way to get around it. There's no other way to get around it.
Isn't there the Director of Health and Human Services who's currently civilians in charge of the whole thing, so she can overrule those 15? Theoretically. So that you have the 16 here.
15 that is super powerful.
Superpower. That's also not elected. Presidents.
Will Obamacare mandate vaccinations such as flu, shingles, HPV on all adults and children?
So when I'm talking about the preventive services, this preventive services task force is taking a look at this. And so it's not sort of a backdoor mandate, I would suggest, that if you eliminate co-pays for these certain vaccinations and then eventually require that plans cover all of this, it is a backdoor mandate for that type of coverage.
So you're saying this Obamacare is Trumpacare? And you're saying this Obamacare is an abomination?
So how did we get into such a terrible situation up until this point? I mean, did it all start with Obama? I mean, how did we get into...
It started long before him. But with respect to following up on the vaccine issue, we're already almost practically there. You know, for the most part, most states, I mean, they're seeking to eliminate the few exemptions that we have. The medical exemptions are being eliminated, the philosophical exemptions. And if anyone wants to put their kids in school or wants to work in a hospital, you know, you're going to be forced to get these things, or you know, life will be very difficult. So this is a really independent of the Affordable Care Act. We are on a rapid road to that. We do a lot on our site to promote the National Vaccine Information Center, to give people the right to choose, the freedom to make that choice, and to know the downsides. I mean, these vaccines come with a risk that you need to be informed about.
Yeah, and I failed to mention too with the shingles, with respect to shingles, going back to the essential health benefits and state mandates, that is a state mandate. So insurers are required to cover shingles vaccine. So it's a push on the insurers and something they have to cover. Influenza is not there, but shingles is.
May I share something with the panel? The people in the room. This is not down the road. I don't know if you could hear me, but 3 weeks ago, the reality hit home. A relative of mine that lives 1 block away in Palatine was taken to Glenbrook Hospital, I'd like to provide more names, with a broken hip, and was told she was not going to be admitted because the guidelines said that she would need to go home. Thank you so much, Shannon. And she was going to be sent home. Her hips were bad because of prior radiation. All right? We demanded, we made noise, and it's only because we made major noise that a second opinion was brought in. This is at Glenbrook Hospital 3 weeks ago. They sent in Nurse Ratchet to her to tell her you don't want surgery. It's not in the guidelines, and besides, you can die under the anesthetic. Please let me finish. Dr. Roy's associate, orthopedic surgeon, if I can name names, I will, God bless them, from the Illinois Bone Institute, came in at night as a second opinion, only because great noise was made by Dr. Chan. He said to her, because he knew he could not override the hospital, she was given only one choice by the hospital, and that is go home and perhaps, most likely, possibly in 6 weeks, maybe it'll mesh and knit together. The second opinion said you have 3 choices. Okay, 3 choices. 1, go home. 2, we'll put in pins, it won't work. Or we could do a hip replacement. We did a hip replacement. This is the second opinion that came in. The next day he told her when he opened up her hip, the pieces of the bones fell in his hands. She was going to be sent home. And it's only because noise was made. And then, just my last line is, the nurse Ratchet came in and said to her, so, you got your way. So help me God.
There's a real life testimony, those are things that are
It's
happening.
going on now, it's now.
But that's not the problem, really. I mean, of course it's going to get worse. That example is going to magnify. But the problem is, that's an end stage. You need to treat it well before that. There's no reason we should ever have a hip fracture. If you're doing the right things, you're getting exposure to vitamin D, you've read about food.
No, this was radiation from cancer.
Okay, well, the cancer is the same issue. You know, most all chronic degenerative disease, if you apply simple, basic principles, your body will stay healthy and you will not get sick. I mean, that doesn't, obviously that excludes traumas. But for the most part, 80% of this, the head of the CDC said that those are chronic diseases that we can prevent. And that's why it's so important to take control of your health with these simple measures. Otherwise, you're going to wind up in that case, and you're going to be responsible to some faceless bureaucrat who's going to make that decision for you.
But eventually we all die from something.
Yes.
So
No,
we will
thank
have that
you.
experience sooner or
Thank
later.
you.
And the iPad,
To you up there, ma'am, you asked a great question. And it was a great frustrated question. President Obama didn't start all of this. Look, we have speaking as someone who works in Washington, there is no greater issue in the country than this. We have 10,000 Americans retiring every day. And you know what? We're not dying when we're 62 or 3 or 4. We're living longer, okay? But as a country, we have not come to grips with how to pay for all of that cost, all of that healthcare cost for our aging population. And we had better. Now, I think the route we're going down right now with Obamacare is going to make everything a complete disaster. But you make a great point. Until the country gets serious about that, many of you have heard me say this before. This thing we call Medicare, this important program, Medicare, if we don't do a thing to it, it's gone in about 8 to 10 years. It's gone. If we don't touch it. So for any politician this year to say, don't touch Medicare, they're letting it die. And it surely won't be there for our kids and our grandkids. This is scary stuff. It's going to be a lot scarier for our kids and our grandkids. 10,000 retire every day. Come to grips with that, America. We have to.